Hi, everybody, and welcome to the RMF Healthy Pet Pod, episode number 2. In this episode, I'll be talking about two of the most beloved quote-unquote superfoods that also serve as remedies in the alternative health community. Those are garlic and turmeric. I'll also be talking about urinary tract infections in dogs. But first, let's talk about garlic and turmeric. As I've mentioned before with regard to garlic, there's hardly a substance on earth that you can expect stronger opposition to than if you say something bad about garlic. People love their garlic and they have thoroughly convinced themselves that it is a healthy food. The belief system that surrounds garlic is very well entrenched in our culture. The use of garlic enjoys a very colorful history that mostly centers around Central Europe and Italy. Supernatural powers are ascribed to it, like that it repels vampires and protects its users from contagious disease. It also has been used as an antiseptic on open wounds in wartime. The particular constituent in garlic that kills microorganisms and gives it its pungent flavor and fragrance is called allicin, and that's spelled Allicin, which is an extremely irritating liquid. Whether it is consumed internally or just applied topically, as in the case of open wound care, it causes as much harm to healthy cells as it does to microorganisms like bacteria. As we know, bacteria do not produce disease. They perform a very valuable, life-saving, in fact, role in the body. These useful organisms come into action when the cell has finished its life cycle. They decompose the dead cell and help eliminate it from the body. They also act to clean up toxic material, which the body eliminates. This is why they are so often seen during a disease process. Like firemen are seen around fires, flies are seen around garbage, and mosquitoes are seen around stagnant water. The lungs and skin seem to be the ways that the body chooses to most efficiently eliminate garlic. That's why people who eat a lot of it, and I suppose dogs as well, have breath and body odor that smell like garlic. In addition to killing bacteria, the pungent oil in garlic also kills intestinal worms. This is one of the main benefits that it is used in dogs for. But it stands to reason that any substance so harmful that it kills parasites also does great harm to living cells, especially those that make up the delicate tissues in the intestinal tract. It's kind of a revolutionary idea if you've not heard of it before, but it's actually not necessary to kill parasites. Parasites don't attack dogs with a clean internal terrain. It's not the actual body of the dog that the parasite is after, but the waste that accumulates there. Just like bacteria and fungi, larger life forms like worms also act as waste decomposers. If we want to be rid of them, all we need to do is attend to the waste load in the dog's body, which provides food for parasites and is what motivates them to inhabit a dog. Besides killing parasites, garlic is generally said to boost the immune system, act as a natural flea and tick repellent, help prevent blood clots, and support healthy digestion because it kills bacteria and fungi. Let's just take a look at these presumed benefits and see if they're really beneficial. Firstly, we know that the entire construct of the immune system was manufactured whole cloth by the medical industry to support the practice of immunization. And the idea itself has spawned a cottage industry of its own that sells lots of useless products. There's no such thing as an immune system because there's no such thing as immunity or immunization. There are no attackers or invaders because disease is a process that involves accumulation of both waste and injury to the internal body. How about as a flea and tick repellent? Vets will say that garlic doesn't work because they would rather sell their pharmaceutical products that actually do work to keep fleas and ticks away. These products do this at great cost to the dog, unfortunately, and that's why they should never be used. So the idea of using garlic for this purpose has gotten a great deal of traction in the so-called holistic sector, and it is ferociously defended because anything that is opposed by allopathic vets and drug companies is automatically seen as good. We've seen this repeatedly with popular home remedies like DMSO, turpentine, apple cider vinegar, urine therapy, ivermectin, and many others. It is perceived, unfortunately, that anyone who speaks out against these things because they are harmful is supportive of big pharma. Natural hygiene often finds itself in this position. It's hard to say whether garlic actually works to repel fleas and ticks because when you try to ascertain this, you discover that there's very little real evidence that it works for this purpose. I was not able to find a single scientific study that researched this idea. There has been some research on the safety of garlic, and most of these involved feeding excessive quantities of garlic to rodents. In these overdosed rodents, a type of anemia was seen that happens when oxidizing agents attach to red blood cells and cause a higher turnover of these than is normal. And that would be bad, of course, because eventually the necessity of accelerating the production of red blood cells outstrips the body's capacity and results in enervation of that particular system. And that's what we call anemia. In this case, it's what's called hemolytic anemia. Garlic has also been shown to increase bleeding in experimental subjects by inhibiting platelet aggregation. And I'll have more to say about why this is bad later when I talk about the so-called benefits of garlic. The subjects in experiments are given unrealistically large doses of garlic in order to induce these effects. But even when the dose is not large enough to produce a visible or measurable effect, it is still doing harm. And none of these effects would be desirable for dogs or dog owners, especially since there are non-harmful ways of repelling, managing, and avoiding fleas. The best way to do this, of course, is to feed properly because, like all parasites, we know that it's not the host that attracts them, but the indigestible wastes that provide a banquet for them. Fleas can also live in our homes without the host, consuming dead matter in our soft surfaces like bedding, furniture, and carpeting, so they do need to be managed if the owner sees them in the home. Personally, I've not had a flea issue in at least 15 years, and my animals get absolutely no protection in any form. My cat currently stays indoors, but has been allowed to roam previously and has still never brought fleas home. Now, garlic is also what's known as a vasodilator because it causes blood vessels to widen. This is probably how it decreases blood pressure in humans because the area through which the blood is flowing has temporarily been expanded. But this is actually the way that the body uses to accelerate the elimination of the garlic and mitigate the harm that it does. And remember what I said about how garlic is supposed to prevent blood clots? In preventing blood from clotting pathologically, however, it also prevents it from clotting normally, like in situations where clotting is desired. And it also causes the blood vessels to perform at a level beyond their normal capacity, which it cannot sustain. This is the problem behind all substances that stimulate the body to accelerate or expand its output beyond its normal capabilities. It not only cannot sustain that level of output, it must be compensated later with rest so that it can recover. Both high blood pressure and the tendency of blood clots to form are pathological conditions for which there are causes. And if a person wants to enjoy a body that is free from these problems or wants to prevent them in his dog, He need only attend to the causes. If you do that, there's no need for remedies. Quoting from an article in Dogs Naturally magazine, a writer named Rita Hogan says, quote, garlic's pungent energy warms the body. Pungent herbs move energy upwards and outwards to the body's surface, improving circulation, unquote. Let's just take a look at that statement. Firstly, there is no substance on earth that can warm the body except by thermal transference, and garlic has no heat. It is inert, so it cannot generate anything on its own. The heat is produced by the body. The body acts on substances, not the other way around. So it's the body's heat that's being wasted, and we know why, because what garlic does is causes the body to accelerate its processes in order to get it out quickly. There are many other substances that have this stimulating effect on the body, and they are known to be harmful and irritative, like caffeine, nicotine, cayenne powder, cocaine, and amphetamines. Garlic has also gotten some attention for its anti-cancer properties because it's been shown in some studies to reduce the progression of tumors in experimental animals. We can't take this to the bank either, however, because many other harmful substances also slow tumor growth or stop it altogether. And once again, we have to defer to the general principle that the body forms tumors as a way of protecting and preserving life. So we can automatically know that this should not be a desired goal. When dogs that have tumors are switched to RMF, very often tumors go away or get smaller without the introduction of anything into the body that will require it to work harder to eliminate. You may recall that I took a poll earlier this week in the rotational monofeeding Facebook group, and of the 34 respondents with dogs that had tumors coming into RMF, 30 said that their dog's tumor either went away or didn't get bigger. What else reduces tumor activity? Chemotherapy does that. And I don't have to tell you that this is a very costly way to approach a problem that requires only removal of cause. Dogs Naturally magazine claims, among many other things, that garlic, quote, stimulates the lymph system to remove wastes, unquote. But does it really do this? And if so, at what cost to the dog? We can know right away that this is going to be costly because any process that is stimulated beyond its adapted normal baseline capacity is not going to be able to continue at that level of performance long term. In fact, most of the time when a process or organ is stimulated, it doesn't function very well at all. And sometimes it shuts down completely. The best way to assist the lymph system is to avoid overworking it. The lymph system is the body's waste removal system. So making sure that your dog is eating only biologically appropriate foods in adequate and not excessive quantities is going to be the best thing for the lymph system. So let me just summarize the problems with garlic. It contains a caustic, volatile oil called allicin that causes harm to cells, even while it kills organisms that are misperceived to be harmful. Many of the claimed benefits of giving it to a dog are largely unsupported by science. You'll mostly hear this from the fans of Big Pharma, but that doesn't mean it's not true. And the conditions it is said to help with are best approached in other ways that are much more favorable to the dog's overall health. For my part, I just have to say I never understood the appeal of garlic, and I was very happy to learn about 25 years ago that it is actually not a healthy food at all, whether it is ingested by a dog or a human. The next topic I want to talk about today is turmeric. If you're not familiar with turmeric, it is a gold-colored powder that is made from the root of a flowering plant in the ginger family called the curcuma longa. It contains a chemical that is irritating to the body called curcumin, not to be confused with cumin, which is an entirely different substance. Curcumin gives turmeric its yellow color. Curcumin is in a family of complex substances called polyketides, which are all toxic to the body, but which vary in their toxicity. On the scale of toxicity, curcumin is considered to be mild, especially compared to others like aflatoxins. But the fact that it has medicinal, quote unquote, properties is consistent with it being toxic. A substance cannot have this characteristic if it's not toxic. Polyketides form the basis of many pharmaceutical drugs. Some recognizable drugs that are synthesized from or otherwise derived from polyketides are ivermectin, tetracyclines, chemotherapy drugs, statins, various immunosuppressants, and resveratrol. You may note that this is a very diverse list, which means polyketides have a wide range of effects in the body, but they are mostly prized for their anti-effects, meaning antibacterial, anti-cancer, anti-tumor, anti-cholesterol, antifungal, and anti-parasite properties. Polyketides are natural compounds, but since they have provided the basis for many pharmaceuticals of enormous commercial value, we're not likely to hear anything bad about them, at least not on the internet. Turmeric enjoys a great deal of popularity with alternative health professionals. With it, they can have it both ways. They can reject most pharma drugs, but at the same time achieve effects that are similar by administering turmeric. Turmeric enjoys such a large following by both conventional and alternative health-minded people that it's difficult to find any scholarly articles about its harmfulness. The only health-related sector that has not embraced the medicinal use of turmeric is natural hygiene. Natural hygienists, of course, look at things more objectively, which is what I'm trying to do here. And we're not only objective about the harm that turmeric does in the body, but we also ask the question, is there a less harmful way of approaching the problem that works just as well or better than turmeric? That's something that is never done in either allopathic or alternative medicine. And this is especially true of the alternative practitioners because they refuse to concede that even natural products do harm to the body. They see only the benefits, and these perceived benefits are mostly based on their inability to think critically about the warlike medical ideology. If we're going to use a war metaphor, it's like the allopaths go to war with nukes and chemical weapons, and the alternative practitioners use clubs and arrows. But neither camp ever wonders if there's a way to solve health problems without making war on the body at all. Now, turmeric may or may not be as toxic as garlic. In fact, this may not even be quantifiable. But it's the very behaviors that it induces in the body that render it medicinal and harmful at the same time. Anything that is medicinal is actually harmful, which you should understand by now because of what you now know about garlic. In addition to medicinal uses, turmeric has long been used as a food preservative, which also gives us an important clue about the harm it causes in the body. It's interesting that it's always advised that turmeric should be given with food. It's also interesting that the main so-called side effect of turmeric are digestive: stomach upset, nausea, and vomiting. Obviously, turmeric doesn't just inhibit the activity of bacteria, fungi, and parasites, it preserves food that it accompanies into the gut and renders it indigestible. The discomfort that the person or dog feels after ingesting it would be the body signaling its inability to digest the food, presumably because of the impairing effect turmeric has on enzymes and other digestive catalysts. So what we have to do in order to suss out the truth about turmeric, curcumin, and polyketides in general is to look at what they actually do in the body. That's a very tall order because their range of effects is so diverse. While most of these effects are seen as good by all medical thinkers, they certainly aren't good, even if they give that appearance. Especially when we know that removal of cause works so much better, involves absolutely no further harm to the dog, and requires zero risk in the form of interaction with veterinary professionals. What it does require is knowing the biological needs of dogs, meeting those needs, and having the patience to wait for the healing process to complete. That's all much easier than the medical practitioners want us to think. And knowing the harm that turmeric inflicts doesn't require a lot of specialized knowledge. It only requires us to know that it kills bacteria, kills parasites, stops tumor formation, halts inflammation, and in general, inhibits the natural measures the body takes to protect itself. These measures are misinterpreted by the medical industry as problems that require us to add something to the body. This response has been promoted as the first resort because it enables the exchange of money. So the medical and veterinary professions would prefer that we not ponder why the body is taking these protective measures. Once we do that, it's easy for us to take matters into our own hands by simply removing the body's reasons for employing symptoms. The medical industry in general, in fact, declares the question of causation as pretty much unanswerable. And on a microscopic or reductionist level, they're correct. But on a macro level, we can infer that these protective measures the body takes are due to the body's needs not being met in some way. And from there, it's just a matter of putting the conditions in place that do fulfill the body's basic biological needs. Let's take a look at what turmeric is used for and how we might approach these problems in a smarter, kinder way. The commercial pet food industry, which influences the thinking of vets greatly in their training, is happy to promote the use of things like turmeric because it helps them establish inroads with so-called natural-minded pet owners, and it pushes the idea that there's always something missing when dogs have health issues. As we know, this enables the selling of a product. On Purina's website, for example, the claim is made that turmeric may support healthy joint mobility, unquote. The problem with that is that we know what causes dogs to have joint issues, and those directly relate to the foods they eat and the amount of weight that they needlessly carry, which means Purina foods are going to be among the worst offenders. All anyone needs to do whose dog is suffering mobility issues, particularly if the dog is elderly, is remove the cause of all this extra weight and inflammation in the body. They can do that easily with absolutely no intervention and no buying of products, including turmeric supplements. And where the presumed benefits of internally polluting products is concerned, we can always depend on our friends at Dogs Naturally to weigh in on why you should buy things like turmeric. D&M says that turmeric turns off inflammation better than chemotherapy, steroids, arthritis drugs, and anti-inflammatories. They might consider that good news, but I'm here to tell you that anything that so impairs the body's normal function that it can't do what it needs to do in order to conduct healing is not something you'd want your dog to be ingesting. It's important to note that where pain management is concerned, turmeric performed better in tests than aspirin and ibuprofen in humans. Whether it offers the same benefit to dogs is an open question, and if it does, perhaps it could be useful strictly in the management of pain. But that's where the good news ends for turmeric. D&M also says it helps fight cancer by killing cancer cells. As you may have heard me say before, cancer cells are created by the body for a reason. Cancer cells are not the enemy. They are the way the body protects itself and attempts to remain living while under the extreme threats that constant dietary abuse represents. D&M also says that turmeric is good for the stiffness that arthritis causes, and it does this once again by limiting the body's ability to protect itself with inflammation. We in RMF know that there's a much better way to relieve this stiffness, and that is proper feeding. Dogs with arthritis typically begin improving within days of starting RMF without introducing anything harmful into the body. Turmeric is said to outperform steroids in the treatment of allergies and joint pain, but the benefits are not the only thing that should be considered when evaluating a treatment. What about the damage to organs? Why are we telling dog owners that they have to choose between extremely harmful pharmaceutical fixes and a natural spice that causes less harm? How about no harm? If I had a dog whose issues I was attempting to relieve, I'd choose zero harm, and that means RMF. And here's more bad news about turmeric. It is said to be a warming spice. What that means is that it causes the body to accelerate its eliminative processes in order to eliminate it quickly. And here I'd like to take a little segue into human health because there are other so-called warming spices that have the reputation as being healthy for the reason that they cause sweating. This is actually seen as a positive effect because it is claimed to be a sign of detox. I will tell you that this is absolutely not a positive thing. It can only mean the body is having to work very hard to get rid of an irritating substance. Sweating can only be a sign of detox when it is accompanied by muscular movement or exercise, but not because toxins come out in the sweat. It's because the waste elimination system of the body, the lymph system, has no pump and relies on muscular movement to be able to do its job of normal waste elimination. So you can forget about all those notions about how you can sweat toxins out of your body. This is one area where the so-called holistic community makes it easy for the allopaths to point out its errors because many studies have been done that illustrate that sweat does not contain a significant amount of what might be considered toxic matter. Sweat may smell differently based on what the person eats, but that's because wastes do come through the skin in the normal course of elimination, and the moisture and heat that occur when a person sweats releases these substances into the air. They are not contained within the sweat. Likewise, when turmeric is given to dogs, they often have to pant to cool themselves down. In both humans and dogs, eating warming substances like turmeric forces the body to use its reserve fluids and energy to accelerate its normal processes in order to eliminate the substance. This is a waste of both fluids and bodily energy in both humans and dogs. When we can remove the causes of symptoms, there's no need to manage or suppress them. And finally, today I want to talk about UTIs, or urinary tract infections. And first, I need to say that urinary tract infections, quote unquote, are not infections at all. This is an important distinction because, as with all forms of inflammation, there's no infecting agent that causes UTIs. There are only substances that come into contact with sensitive tissues in the urinary tract and cause an inflammatory response. In dogs, the source of these harmful substances is the abysmal garbage that passes for food that is sold by the pet food industry. That's why, in fact, UTIs are so common in domestic dogs. That's not to say UTIs never happen in raw-fed dogs, because they can if the owner has not taken care to limit fat consumption. But UTIs can even happen in dogs that are fed a home-prepped raw diet, and I will explain this in just a moment. But first, I have to explain inflammation in general. The body is always seeking to mitigate damage that would otherwise occur because of contact with the irritating substances it cannot use and must eliminate. The body brings heat to the area to accelerate the elimination of these offending substances, and it brings some of its fluid reserves to the site as well in order to dilute them. Remember that old truism: the solution to pollution is dilution. This self-protective response is not a mistake. It should not be turned off with drugs or herbs or other anti-inflammatory measures even including foods that are said to be antibacterial or anti-inflammatory. While UTIs are almost always caused by what the dog has been fed, some drugs like prednisone, NSAIDs, and chemotherapy drugs are also known to cause UTIs. It can also be the case that dogs can have a UTI in response to improvements to their diet. When you clean up the diet, very often one of the detox symptoms you will see is something that might be characterized or even diagnosed as a UTI. When we begin feeding foods that don't create such a drain on bodily energy, the body can then direct some of its energy to the cleaning out of waste that have been stored, mostly in fat cells. These old wastes are liberated from their stored locations, they enter the bloodstream, are filtered by the kidneys, and they then travel through the urinary tract. At any point where the wastes come into contact with sensitive tissues, the body attempts to protect itself by bringing heat and fluids to that area. Sometimes tissues are damaged anyway and even ulcerated, which causes minor blood loss into the urine. These wastes can irritate the bladder lining, which causes the dog to urinate more frequently as well. This is seen very often in dogs that are new to RMF. Sometimes owners will notice a small amount of blood or pinkish tinge in the urine. This is temporary, it's an eliminative symptom, and does not necessarily indicate that any change should be made to the diet, even temporarily. Now, people who are acquainted with how well fasting works to resolve inflammation generally might wonder if fasting is a good approach to a UTI. And when I talk about fasting, of course, I mean nothing by mouth except water. What I would say to that is that fasting may or may not help a UTI. That's because fasting may cause the body to eliminate more of these offending stored substances, which would cause the urine to become more concentrated, and this may exacerbate the symptoms. On the other hand, however, during a fast of a day or two, the urinary system will very likely be used much less than if feeding is continued. This is because all of the natural foods that we feed dogs in RMF, regardless of whether they're plant or animal-based, are very water-rich, which requires the kidneys and bladder to work more often and the urine to be more dilute. So on fasting days, we have very infrequent urination, but the urine may be more concentrated. If we continue to feed, urination will be more frequent, but the urine will be very dilute. Which one of these approaches is going to be better in the case of a dog suffering a UTI is one of those questions we'd probably have the answer to if the people in the so-called research community were doing their jobs properly. Personally, my experience is that when I have seen pinkish urine in transitioning dogs, I have elected to feed plant foods for a couple of days instead of fasting. This always results in a return to normal within 48 hours. The reason I favor plant foods over animal foods when a dog is suffering a UTI is because no matter how much we work to remove the fat from agricultural meats, there is still far too much of it for many domestic dogs. And the substances that these fat cells stored while that food animal was alive, plus the increased acidic waste products of protein metabolism that are produced when a dog eats meat, may further irritate a dog already in the midst of a UTI. Now you know the real causes of UTIs and how they should be properly approached. So let's look at how veterinary medicine explains, tests for, and approaches them. Probably everybody that's hearing this would not be surprised to hear that most UTIs are blamed on microorganisms or viruses. And this sets up a whole torrent of mistakes that not only don't address the real causes, but they also lead to chronic or recurring UTIs. According to veterinary statistics, in fact, fully 1/4 of all dogs that have UTIs will experience a recurrence, and I think that estimate is very low. Since microorganisms are blamed for UTIs, the tests aimed at diagnosing a UTI must involve identifying the bacteria in the bladder. This is typically done via a procedure called cytocentesis, which involves collecting a urine sample directly from the bladder by sticking a needle through the abdominal wall directly into the organ. The industry maintains that when this direct method is not used and the urine sample is collected in a receptacle of some kind, there is a chance that the urine will be contaminated by bacteria on either the receptacle or from the dog's own genitalia. And with the possibility of other potential suspects ending up in the sample, they can't be sure what kind of antibiotic to administer in order to kill what they view as the real culprit. So let's take a look at these mistakes that flow from the widely accepted but false notion that UTIs are caused by bacteria, other microorganisms, or viruses. Already, with the necessity of sticking a needle into the dog, dogs and dog owners are faced with collateral damage, including pain and stress, because typically no anesthesia is administered during the procedure. Anesthesia can be necessary when dogs are anxious and difficult to restrain, so those additional drugs would be added to the costs. And I'm sure you know that what I'm talking about here when I talk about cost is in terms of toxicity to the dog, not the cost to the owner, but of course there would also be that. Fortunately, this urine collection or this urine collection procedure, this sample collecting procedure is typically not expensive. But as it turns out, the sample collecting procedure is the smallest part of the cost for UTI diagnosing. After the sample is collected, it will then be sent to a lab for culturing. This is where the urine is placed in a centrifuge so that the liquid can be spun out, revealing only the sediment, which includes cells, bacteria, crystals, and other particles called casts within the urine. The lab will identify the bacteria that are found in the sample so that a specific type of antibiotic can be prescribed. This procedure, unlike the sample collection, is rather expensive, costing between $120 and $120 and $250. And remember, we haven't started treating it yet. Although bacteria are normally blamed for UTIs, the vet industry says that other conditions can cause them too. Things like diabetes, Cushing's disease, and bladder stones. But all of these other conditions are merely concurrent effects, and effects are not causes even when they happen downstream of another effect. They are merely cascading effects, all caused by the very same underlying factors. In order to understand why all of these conditions happen, we have to look upstream to the diet, which is the source of almost all canine disease. Now, there is more bad news when it comes to the veterinary approach to UTIs, and that is, as I mentioned, the treatments that they use very often do not offer a permanent solution. According to a veterinary periodical called DVM 360, the industry's criteria for labeling a UTI problem chronic is if a dog has 3 or more UTIs in a 12-month period. Notice that if a dog has only 1 or 2 recurring infections in a year, this is not considered recurrence and does not get entered into the statistics. So I have to think that recurrence by any reasonable definition is much more common than 25%. And even if it's only twice a year, that's a lot of unnecessary stress, cost, and continued suffering for the dog, not to mention vet bills in the hundreds every 6 months or less. And speaking of the veterinary approach to UTIs, I watched a video recently by Dr. Andrew Jones where he talks about the increasing problem of the corporatization of veterinary medicine. In this video, he references a study that was done recently in Canada where a group of researchers took dogs with suspected UTIs to various clinics so that they could compare the cost of diagnosis and treatment. What they found is that the costs were extremely varied. This led the researchers to strongly advise pet owners to ask not only about the cost of an office call when they call around to find out prices, but about the costs of the diagnostic test as well. Apparently, they found that the cost of an office call didn't vary as widely as the cost of diagnostics. And this might be a good thing even for RMFers to note as well, since we do still sometimes have to depend on diagnostics when we have injured dogs or possible foreign body obstructions. There is a school of thought that holds that the alkaline pH of the urine causes or contributes to UTIs, and that diets high in carbohydrates can create alkaline urine. But this conflicts with known information, such as the evidence that we have that wolves in habitats that support the inclusion of plant foods, sometimes to the near exclusion of animal foods for sustained periods, do not suffer UTIs. It's not like we don't have evidence that dogs are perfectly suited to eat certain plants as secondary foods without pathological effects. We do. And we also have what some might call the anecdotal evidence of RMF dogs experiencing UTIs initially during detox, but then never experiencing them again in their lives. And some of these dogs are fed a very high percentage of plant foods by volume. Carbohydrate bashing seems to be the fashion right now, and very often negative conclusions about them causing or contributing to disease are not only biased, but are arrived at based on the low grade and inappropriate carbs that are used in commercial dog food. Now, with regard to the treatment of UTIs, I'm very sorry to say that what the holistic vets offer as solutions are only slightly better than what the allopaths do. The holistic people do sometimes approach UTIs from a dietary angle, and of course, this is going to be helpful to whatever extent the information is correct about what dogs truly should be fed. They will also recommend that dog owners do things that dilute the urine and increase urinary output, and this will inadvertently solve the problem until the dog is put back on the food that caused the original UTI. However, due to their training, holistic vets will typically give very little critical thought to the issue of underlying causation, at least to the extent they need to in order to understand UTIs. Like the allopaths, they also blame bacteria for UTIs and will recommend things like honey, D-mannose, cranberry supplements, and other herbal remedies. The effect that cranberries and D-mannose is said to have is that they cause bacteria to not adhere to the bladder walls. The problem with that is that if bacteria are there beneficially, which of course they are, in order to perform their role in the decomposition of waste, they can't do it if they can't function normally. Holistic vets will also recommend things like glucosamine, which decrease inflammation everywhere in the body, including the bladder. But we know that forcing inflammation to stop is absolutely not an appropriate goal, even if these less toxic methods are used. Regardless of whether we choose the very damaging weapons of the allopaths or the more gentle ones the holistic vets employ, this approach is adversarial toward the body. We can manhandle the body if we want to, but nature always has the last laugh, because forcing inflammation to stop by dominating the body's processes only guarantees its recurrence. One thing that might seem like a conundrum within the natural hygiene explanation of UTIs is the fact that they are much more common in females than males. UTIs are. The germ theorists have a very tidy and seemingly logical explanation for this because they claim the shorter and wider urethras in females make it easier for bacteria to travel up to the bladder. However, since we know that bacteria do not cause inflammation of any sort, there must be another explanation for this that fits within the natural hygiene paradigm. Before we can assume that the bacteria in the bladder are causal, logic and Occam's razor force us to look at more rational and down-to-earth explanations. There are many examples of conditions afflicting one gender more than the other based strictly on gender disparity and anatomical dissimilarity. And many of these conditions have nothing to do with germs, such as heart and joint issues and anal gland cancers, all of which afflict males much more than females. The germ theorists offer no explanation for this. Even if the incidence of health issues in general is higher in females than males, that still doesn't give us the latitude to accept unproven and unlikely causes, especially when acceptance of those ideas leaves us powerless, like the idea that bacteria cause UTIs. When the real causes of illness exist, illness will present differently based on the structural morphology and genetic diatheses of that particular organism. What this means is that in the case of UTIs, when their real causes are present in male dogs, other symptoms will occur besides UTIs. That doesn't mean males are healthier or less toxic. It only means their symptoms are expressed differently. But even if it's impossible for us to know within the natural hygiene paradigm why females are more prone to UTIs than males, we still retain our power. With the knowledge that the general cause of all disease in the body is toxemia and enervation, we have the power to prevent UTIs and reverse them naturally in ways that are proven to work over and over. We don't have to give our power over to the people who have the products that kill bacteria. That's why the whole germ story was invented. Well, I hope you've enjoyed these topics. If you have any suggestions for future topics you'd like me to get into, please feel free to message them to me through the website. Thanks so much for spending this time with me, and please watch for the next episode of the RMF Healthy Pet Pod.